let's talk a little about aesthetics because I'm a classical. Most people think I'm very eccentric and I like strange things and but in fact, when it comes to aesthetics, I like the classic because I'm a painter myself and I like to paint portraits and I'm a photographer. So I love to look at people's features and my aesthetic comes from self-taught portrait painting. And I always looked at the sketchbooks of Leonardo da Vinci and Michelangelo.
Obviously, in plastic surgery, you have a lot of trends, and the trends change with time.
Yeah.
And those trends you may or may not agree with, depending on what it is. Now, my personal thing is when people come in, they tell me what they want, and I'm kind of like more of a person of I decide kind of whether or not I agree, and if I disagree with what they're trying to achieve, i.e., I don't think it looks good. They might think it does, and I've got no problem with that. There's no point trying to do something that I am not going to be happy with, and not even because it's not something I want to produce.
Yeah.
So therefore, I usually decline. Better in the hands of someone who's willing or able to produce what they want.
It's not right. There's no right or
Yes.
wrong, but it's just how I would prefer.
Yes.
I don't want to look like that. And I notice a lot of people that nowadays, they have this perfect chin, which doesn't happen in reality.
You're actually very right on that
Yeah.
aspect, because what it is if you look in nature, nothing is completely symmetrical, nothing's completely perfect.
Yeah.
So the way I always tell patients, or whatever it is, if you take your face, if you put a mirror right down the middle of your face, and you basically get a computer to do it, and you literally take the right side of your face and you flip it completely other side,
you look
the
totally
resulting
different.
face doesn't look anything like you, because no one is completely symmetrical.
Yeah.
In actual fact, if you do anything which makes your face completely symmetrical, that's actually a very big hallmark or dead giveaway that you've had something done.
Yeah.
Because no one looks completely symmetrical.
Exactly.
So, and also I find, and it's actually probably pretty well documented, if your face has certain, I wouldn't use the word blemish, but something that sets it apart from something else, and it could be a quirk or it could be something like that, actually 9 times out of 10 is actually more attractive.
Yeah.
So I think, like a lot of people sometimes say, you might have heard it before, like beauty spots.
Yeah.
And various things.
Yeah.
For some reason, it's attractive.
Yeah.
Or for some people, certain celebrities or whatever, they don't have a symmetrical smile. They have what we call a crooked smile.
Yeah.
But the crooked smile is their hallmark, and it also, for some reason, looks attractive. It's like that's your signature.
Yeah.
It's like that people really remember these people for these specific features.
Yeah. I see a lot of, when you walk down the street, you see women with beautiful noses, and then they have a round face.
Yes.
And how could you have a round face with a pointy nose? Just in natural, in the nature, it doesn't happen, right?
I think with a lot of that is sometimes it's a very fine line, because some people, especially when they come into to the clinic, they have a feeling what they want. So they decide that because, for instance, they might have seen a particular celebrity and they really like their nose, but not much thought goes into whether that nose actually suits them.
Yeah.
So there's a lot of the time you have to take into account of their whole face, their face shape, skin quality, and even their features themselves. And what they want is whether or not you're able to balance everything to look like it's harmonious.
Yeah.
I think more importantly, especially in the face, it's to balance everything to make it look harmonious, rather than having one standout feature. Because yes, you can put a very beautiful nose, like very pointy nose on a round face, and your nose will stand out. But that doesn't necessarily mean, in isolation, because the nose looks good, that you look good in general.
Yeah.
Everything must blend in, like kind of in a very harmonious way. I always suggest to people is, rather than waiting to getting to the point where one day you realize you're 60 something and you look 60 something, the best thing to do is actually start early. I'm not telling you to start going under the knife in your mid-20s or 30s, but what you do is you start doing little things. So maybe in your mid or late 20s, you start doing things like facial spas and various things. Maybe an odd bit of Botox just to to keep the wrinkles at bay.
Yeah.
And then, as you approach maybe sometime in your 30s or whatever, aging, moves along a bit, you might need a little bit more. You might need a touch of filler here and there, just again, to keep things at bay. And slowly, progressively, as you hit your 40s, you might want to consider things like machines, such as things like Ulthera, Thermage, threading, some biostimulators or whatever it is. And if you keep this up, what will happen is you're staving off the aging. And then at some point, it will be a point where nothing can help you except surgery. But then hopefully by that case, because you're what I call your canvas, your base canvas, you spent so much time looking after it, then to actually make yourself look younger is actually not hard. But if you've spent your entire life not really caring about it, not really done anything, then you basically set the framework for a lot of work to be done. And therefore, if you haven't taken the care to achieve the results that you want at that age after having, for lack of a better word, neglecting all that time, then the results that you want might not be achievable. No one's going to start writing up about someone who had an amazing facelift or whatever it is and looks completely natural, whatever it is. But when a celebrity has a botched up surgery, all of a sudden it's instant news. And people will write about that.
Yeah.
So negative news always sells better than positive.
Exactly.
So there's a lot of that
And
involved.
the good ones you don't see.
Yes.
You only see the bad ones.
Yes.
So that's why that scares a lot of people.
I think like a lot of misconceptions that people tend to have about plastic surgery is they have these images in the head of people who are overdone. Okay, and obviously that's one extreme. But what I think, the trend nowadays is people want something that looks natural.
Yeah.
As I say, if you're 60 something and you want to look maybe in your early 50s and maybe even late 40s, that is achievable. And I think it's like the perfect mentality to have. The wrong mentality to have, and I think what all of these kind of overdone kind of people are, is they're in maybe like maybe in their 60s, but they're chasing the look of when they were in their 20s.
Yeah.
And they're trying to iron out every last wrinkle.
Aging is not like a linear.
Yes.
It's suddenly,
Yes.
at some point, it suddenly ages.
Yes.
Really fast. So
for me, I think like for a lot of it, it's very arbitrary because there's obviously it depends on the person. But I usually find that most people don't need surgical intervention maybe before 50.
Yeah.
And the only things that you need to do before 50 tend to be relatively more minor procedures, things like eye bags, maybe eyelids. But any drastic kind of surgery probably isn't necessary before 50. Yeah. And we're mainly talking about the face here. Mainly talking about the face. Other body parts different, but if you're talking about the face, drastic things like, we're talking things like facelifts and things like that tend not to be necessary prior to 50. But then that also, like I said, depends on the patients. And also things like race and various things. Because as Asians, we're very blessed that we tend to look very young for our age. You see those horror stories of people who are in their 60s or whatever, and they're trying to chase when they were like the look of in their 20s. Yeah. And they try to iron out every last wrinkle on their face. They want to achieve everything. And that is when it's gone overboard. And I think for a lot of those people, those are isolated cases. I think as long as you fall within the framework of trying to do what I call achievable results and trying to get a result that is what I call commensurate with your age, then you'll always end up looking like natural and good. And that's my personal aesthetic. The other thing about plastic surgery, I think a lot of people also have the misconception is they think it's addictive. They think once they do something, it's like a road of no return and they keep going. Yeah. To a certain degree, yes, that's true, but yes and no. Because like some people, if you're very specific about what it is that you're unhappy with or you don't want, then you can just stop at that. If that's one thing that concerns you, there's no reason why you need to go beyond that. Yeah. So that's within your control. Now, as to why people sometimes do end up having multiple things, it's also not strictly because of vanity. I actually have the way I like to explain it is quite easy to understand. Let's say, for instance, you're particularly unhappy about, let's say, your eye bags. and you choose to want something done about it, which is fine.
Mm.
So you've been obsessing about your eye bags because you think you look tired, and everyone thinks that, oh God, you should get something done about it. So what happens is you go and get your eye bags done, and you look great. Tiredness look is gone and everything. But then the eye bags that you were obsessing over for the last number of years, that's finally gone. Your mind then shifts onto the next thing, that you're unhappy with.
Yeah.
And some people do, and some people don't. But if you do, then you realize my eyes now look very fresh, but my upper eyelids look a little bit saggy now compared to everything. So then you maybe decide that you want to do your upper eyelids. And then after that's done, now your eyes look very refreshed. But then it's just your eyes. If you start touching one area of it, one area looks kind of different, and the balance is slightly affected. So you kind of need to go to elsewhere to balance it back out. It's unlike other parts of your body, whether it's liposuction or tummy tuck or anything like that. Once that's done, because it doesn't put the entire thing out of balance. But on your face, because you have so many features, you can potentially put things off balance, and hence why people have multiple procedures is because you've done one area and then you just need to balance out everything else. So that's very important.
I totally agree with that. Well, you can be sure, I can assure you that I won't do anything drastic for the next 10 to 15 years after this. But, of course, you need to maintain. Everything needs maintenance, right? You can't just, forget about it. And, you have to maintain, you have to eat right, you have to, you have to monitor your sleep, you have to do everything. It's up to you whether you like to try and beat it or you try to live with it.
Yes, I think a very good take-home message is never feel that there's any pressure to have anything. It has to be a very comfortable process, and just make sure that you're at peace with whatever it is that you want. There's no right or wrong answer. It's a lifestyle choice and a personal choice. So, and like I said, I'd like to thank you for having me, and I'd also, thank you for your continued confidence as well. I'll try to do the best that I can.
Kevin, thank you so much for joining me today, and see you soon.